Welcome. Do you suffer from dysphagia or difficulty swallowing? Do you want to practice safe swallowing procedures to prevent aspiration? In this video you will get 7 tips that may help you. What makes aspiration dangerous? If food or drink enters your airway instead of moving down the normal way into your stomach, this may lead to inflammations in your trachea or lungs. Therefore, it is important to protect your airway from food or liquid. I will show you in a separate video the possible causes for why your body's own protection might not be sufficient in the cases of dysphagia. Here are my best tips and strategies for safe swallowing. Don't use straws or sippy cups. Try to drink from a glass or cup in a manner that causes your lips to be in direct contact with the liquid. Your muscles and reflexes will be able to prepare for the swallowing procedure. Using a straw or sippy cup with a long mouthpiece that reaches deep into your mouth, the liquid will immediately land in the middle or back part of your mouth. This results in very little time to sense and perceive the liquid, to prepare the protective reflexes for swallowing, and close the trachea with the epiglottis. In cases of sensory disorders within the mouth, it is even more important to bring the stimulus or liquid in contact with many parts of the mouth to allow for a better sensory processing and easier awareness of the liquid. In addition, straws and sippy cups make it much more difficult to control the amount of liquid or how fast the liquid flows into the mouth. Perhaps you prefer to use a sippy cup because of a tremor or because of a weakness of the corner of the mouth. In this case, I recommend you make sure that the mouthpiece of your sippy cup does not reach far into your mouth, or that you use a special dysphagia cup shown in tip number 4. Never try to drink while lying down. Always try to sit in an upright position to eat or drink. Tilt your head forward and lower your head and chin towards your chest before and while swallowing. This swallowing technique is called chin down maneuver. This will support the posterior shift of the epiglottis to a more protected position over the airway and a better laryngeal closure. In addition, it may prevent liquid from flowing into the pharynx too early, especially in cases of a delayed swallowing reflex. You should keep your head upright, take some liquid into your mouth, hold it in the front part of your mouth, and then lower your head to swallow. If you suffer from a delayed swallowing reflex, it is better to lower your head even while you let the liquid flow into your mouth. In this way, you can keep your head in the lowered position during the entire drinking procedure. This will only work if your glass is quite full. With a half-empty glass, you would have to tilt your head back to allow the liquid to enter your mouth, which you should absolutely never do. Tilting your head back will increase the risk that liquid will enter your airway. To safely drink from a half-empty glass, you can implement the next 2 tips. Use a cup with a nose cutout. With this method, you can keep your head tilted down constantly during the entire drinking procedure. Due to the nose cutout, you will be able to tilt the cup further upward without hitting your nose or forehead. Here's another helpful invention. Get a becker cup, made by the company DYSPHAGIA. There is a membrane inside the cup in which you pour the liquid. The membrane adapts to the amount of liquid and always keeps the liquid at the rim of the cup. With the becker, you can keep your head tilted forward and down from the moment you place the cup to your lips. The cup can also be used open or with a lid and short mouthpiece, comparable to a sippy cup. There is a valve inside the lid, which only allows the liquid to be poured out when the cup is tilted at a certain angle. Spilling can be avoided if the cup falls over. It also forces the person to lower his or her head to a chin-down position to be able to get the liquid out while drinking from the cup with the lid on. This can be a useful reminder in everyday life to implement the protective chin-down maneuver. This cup can also be used for hot drinks and for thickened drinks. The mouthpiece of the lid is quite flat, so that the lips can still get in touch with the liquid. At the same time, the mouthpiece helps people with facial paralysis to lead the liquid easier into the mouth and to keep the liquid from running out at the corner of the mouth. Further information can be found on the DYSPHAGIA website. Avoid lukewarm or room temperature drinks. With sensitive disturbances or with a delayed swallowing reflex, it may help to make sure that the temperature of your drink is not lukewarm, but clearly cold or hot. A significant difference in temperature from your body temperature makes the awareness of the liquid and the reaction to it easier. Try thickening liquids. If the swallowing techniques and measures are not sufficient to prevent aspiration, you can thicken your drinks with a special tasteless thickening powder. This powder is easily stirred and dissolved into your drink. Depending on how much powder you use, your water, juice or coffee will become thicker, as viscous or syrupy as nectar or honey. It will then be easier for you to control the liquid within your mouth, and it will slide much slower backwards into your pharynx. Please follow the instructions of your doctor or therapist when using such powders, so you can adjust the amount according to your individual swallowing disorder. Drink water or tea. If you want to make sure that in the case of an aspiration the drink is less aggressive towards the tissue of your respiratory tract, you can stick to water-based drinks like mineral water or herbal teas. Avoid drinks which are sour like juices or fruity, or greasy or fatty like milk. These liquids are more aggressive and can lead to inflammations faster. You'll find more videos with exercises and tips for dysphagia on this channel. I hope that these tips and tools will help make the drinking process easier and safer for your health. If this video was useful to you, please don't forget to give me a thumbs up, and of course I would also like to invite you to subscribe to my channel. See you soon!